Over the last 4 years, of the over 25,000 cases of child abuse reported across the country, only 1,059 involved instances where the child has a physical or mental impairment. 302 cases of sexual abuse against children in the disabled community were reported to the Office of the Children's Registry (OCR). Some 278 cases of physical abuse against these children were also documented. However, the most prevalent instance of abuse against disabled children is neglect, which accounted for more than half the number of cases reported.
The fact that a child who is disabled demands a greater level of supervision than another child, and where you have parents with disabled children who are working parents, sometimes it poses a problem, especially if they are from single parent household. And you know, quite a number of single parent households exist now in Jamaica. Sometimes you find that persons who are assigned then the task to look over, supervise these children might not fully understand that the kind of attention that is required. Yes, sometimes the parents, I think, probably get frustrated and do not provide the kind of supervision that is necessary.
Keisha Tomlinson investigates reports of child abuse for the Child Development Agency, and she says investigating cases of alleged abuse in the disabled community isn't always easy.
Where they are unable to express themselves clearly, usually there is some probably from the family member who understands them and can interpret what they're doing, or we might need to refer them for counseling, where counselors can work with them to get out of therapy what has happened and how it has happened. And depending on the allegation, you might be able to get the information from a medical report where they can't say, you know, this is exactly what happened, but where the allegation is X or Y is happening to this child, for example, sexual abuse, then the doctor can tell if indeed the child was sexually abused.
The children's officer points out that a special approach is needed when investigating alleged cases of abuse involving disabled children.
Sometimes you might have to ask them to draw if they aren't able to speak fluently. Sometimes you might have to ask the guidance counselor at the school that they're attending to interpret for you, or get some interpreter to interpret what they're saying if it is you're not comprehending what they're saying, if they're using sign language, etc. You have to be a little bit more patient because the information might not come as quickly as someone who can express themselves freely. And so it requires a little bit more time and effort in getting the information.
One of the theories proposed to explain the underreporting of abuse against disabled children is the fact that oftentimes there is a communication barrier between these children and their parents. For example, not many parents of children who are hearing impaired know sign language. The Office of the Children's Registry (OCR) says it recognizes that reports of abuse in the disabled community are grossly underreported, and that's why the organization is working on various programs that will empower members of the disabled community to make reports.
Because of their challenges, they may not be able to share some of the challenges that they're going through if they're being abused. So we would like to encourage persons who are impaired in whatever form to access the OCR by reporting, because unless we're able to get the reports about these persons, they won't be able to access the help that they need. And so even in our public education activities, we're currently seeking funding in terms of our campaign, to have a campaign directly targeting children with disabilities so they're able to access the information on child abuse and reporting in the form that is most accessible to them.
Dealing with the needs of a disabled child isn't an easy task, but the CDA is ready to help.
There are some persons who some parents who might not want to take the time to really care for these children, or would prefer to give them up. But presently, the resources are not there as we would love it to be. We're working on it. So we have to work with the parents, and where they need help in certain areas, they can always come to the Child Development Agency, and where counseling is necessary or other means of intervention, we work with them to ensure the safety and protection of these children, because they are just as important as any other child. All children are important and should be given the opportunity to develop to their full potential.
For Live at 7, I'm Keneal Gale.